we're back. So we're about to start doing our denture care. So what are the things that we need for denture care? Well, of course, you need your dentures, your denture brush, your toothpaste. I like to have paper towel on the table. So I have one paper towel to put my supplies on while they're dirty. And once I finish, I'm going to transfer them to the clean one while they're clean. I have my towel to line my sink. Now, because I'm using my clinical sink in my clinical setting, I'm not using the real sink. I'm going to put my bath towel. This is going to be considered my bath towel, but this is what you would use in a real sink with water. Okay, I don't like to use a lot of water because it just gets a lot messy, so I just do it the easier way. So we're going to pretend that this is your bath towel that you're putting in the sink. So we're going to line the sink with this towel here. Okay, so we just put our towel in the sink. Now I'm going to put on my gloves. I'm going to grab my paper towel to turn on my water. Now we're pretending I'm turning on the water. The water is now running. So now that the water is running, I'm going to take my denture. It usually be in one of these containers. It has water in there. We're going to pretend there's water there. And you're going to pour off all of the water out of there. And then I rinse out, I take the dentures and I sit them in their little strainer, depending on where you're at. You may just sit them on the bath towel, but if you have the strainer that it comes in, put your strainer in the sink. So while I'm cleaning this out, I always put a denture in there just to give you that I'm cleaning it out. Rinsing it once, rinsing it twice, rinsing it 3 times. And then I put my solution, my tablet in there, so that they can be cleaning overnight. So in the morning, all they got to do is rinse them off. So now I have my dentures. They're running in the water. I'm going to make sure I rinse out. I'm going to rinse my dentures. I'm letting them run under the water. I'm going to take my denture brush. I'm going to wet my denture brush. And then I'm going to put some toothpaste on both sides. Then I'm going to put this down, and then I'm going to put my toothpaste on my clean towel. It's on the barriers, on 2 barriers. Okay, so now I'm going to take my dentures and I'm going to brush one surface, one side of my dentures, front side of my dentures, top portion of my dentures, inside of my dentures, and the other side of my dentures. So now that I've cleaned all surfaces of my dentures, I'm going to turn them over. And mind you, you would be over the sink, but I'm trying to show you in the video. So I would take the second part of my brush, and this is where all the adhesive and food and debris may have lodged and got stuck up in the crevices. So I'm going to clean all of those surfaces as well. So I'm cleaning all of those surfaces, making sure I got everything off. Then I'm going to rinse, put this back. I'm going to rinse this, put that in my cup, letting them rinse because the water is still running the whole time. I'm going to clean my denture brush out. Now my denture brush is cleaned, and I'm going to set that on my clean paper towel. And now I'm going to take and just let my dentures run over in the sink in the water in this little container, and they're going to drain. And then once I let them drain and all the water and the excess water is coming off, I'm going to sit this in the sink, in the container that it originally came in. And now that's ready to go. Now I can take and I'm going to just leave the water running. The water is still running. I'm going to go put my supplies away. So I had it on paper towel, right? So all of my supplies that was on clean paper towel, because my hands are dirty, so I'm going to put this away while I'm putting this away, putting all my supplies away. Now I can discard my paper towel. So now my paper towel is discarded. Now I can remove my towel out of the sink. So I'm going to wring all that water out of the sink. I'm wringing all the water out so it's no dripping water going on the floor. And now I'm going to discard all of my supplies that was on my barrier into the dirty linen. So my stuff are going in the dirty linen. So now that it's going in the dirty linen, now the only thing I have to contend with is my gloves to take them off. So now the proper way to take your gloves off, I always go through this because I see students always come and they take them off at the hip. No, you pinch them in the middle, take your glove off, then go up under your glove, discard it in the dirty linen. So now, in the trash can, I'm sorry. So now that I discarded them in the trash, the water is still running. Now I might take a paper towel and adjust it to a warmer temperature of water, and I'm gonna wet my hands. So now I'm wetting my hands. Now I'm gonna apply some soap, washing my hands, singing happy birthday, ABCs, 1 Mississippi, 2 Mississippi, whichever one you were taught that you're comfortable with. So I'm going to be washing in between all surfaces of my hand, up under my fingernails, up to the wrists. Then I'm going to rinse my hands. I should have had washed my hands for at least 20 to 30 seconds. So I'm going to rinse my hands. Then I'm going to grab my paper towel and I'm going to dry my hand. So I grab my paper towel to dry my hand, discard that one, grab another one, dry my other hand, getting all surfaces of my hand, grab another paper towel, and turn off my water. So now that my water is turned off, I'm going to put my table back and ask Ms. Jones, does she need anything else? Because I've already told Ms. Jones that I was going to clean her dentures. And it did not. She's in the bed, so she had already had them on the side of the bed. So I would ask her, do you need anything else? She told me she didn't need anything. So at that time, I would just step back and look at my environment. So I would look at my environment and see, did I leave my environment nice? So just making sure that's out the way. So the next thing I would do is look at my environment. So I would turn and look at my environment and then walk through my skills and make sure I did everything. Did I knock on the door? Did I announce myself? Did I let the patient know what I was doing? Did I provide her privacy? I did it in the bathroom, so I probably already had closed her door, her curtain. I've done everything in the bathroom, so nothing was seen. So I was in the restroom and I did all my skills. So what did I have to do? The skill was denture care. What did you have to do in denture care? One of the things that's bolded on your mock skills list is making sure that you line the sink with something to protect the dentures from getting fractured or broken. So I've done that. I brushed her all the surfaces of her dentures, the front and the back and under the bottom. I rinsed all my supplies. Now, one of the main things on the skills, it tells you do not cross-contaminate. Cross-contamination, you can take that to another resident. So I had paper towel barrier. I had a barrier on the table. I also had a paper towel barrier that I carried those supplies with and put them away. So you want to make sure that you're doing all of those things and then taking my gloves off properly. I did not do it at the wrist. I did it at the palm and the palm of my hand. I peeled them off. Yes, I did all of that. So now that I've went through all the steps of my skill, I'm going to walk myself through it again just to make sure I covered all the areas. And then once I feel confident and I made all the corrections that I need to make, I will then tell my proctor or my test observer my skill is complete. And then I would wait for my next skill. Please click subscribe and share. I will be bringing videos to you on a regular, all of the skills in the state of Michigan. If it's a skill that you want me to go over that maybe I haven't covered just yet, you can wait and see that I'm going to cover it, or you can always reach out to me. I'm at TT Allen. You can always call me and just let me know, and I can go in and do the skill for you. Thank you and have a nice one.